Good evening, good morning, good afternoon, ladies and gentlemen. This is John here, and I'm back with HC3 and my good friend, Dr. David Krause. Now, we've got something special that's coming up over the next little while. We've got a series where we're going to be taking most of the questions that everybody asks on a daily basis or even in a seasonal basis about Legionella. And so think of this as like a little quiz. We're going to answer all your questions. Well, David is going to answer all your questions in a series of videos, and hopefully that's going to give you everything that you need to know to make informed decisions, to find out a little bit more about it. So this is kind of going to be like a quick fire quiz of sorts, and David is in the hot seat. Welcome to the hot seat, David.
Thank you. I think hopefully I've studied well enough.
I haven't thrown in any. There's no curveballs coming in here. So today we're going to go through the first session here. Today is the general understanding of Legionnaire's disease, and when we're ready, I'm going to ask you 8 questions for this first section. Okay?
All right, let's do.
Okay, David. First question: what is Legionnaire's disease, and how did it get its name?
Legionnaire's disease is one form of what we call Legionellosis. It's typically diagnosed as a pneumonia that is caused by an infection of primarily Legionella pneumophila that's contracted in the lungs from inhaling very fine water droplets. So it was first observed and diagnosed in 1976 in Philadelphia, Pennsylvania, at the American Legion Convention at the Bellevue Stratford Hotel. It was certainly a mystery at the time, and the press, Time Magazine, Newsweek, this was a big mystery in the news as to why so many Legionnaires who had attended the convention and some other local people had contracted this pneumonia of unknown origin. It took the Centers for Disease Control and Prevention to come in and do a wholesale investigation of this for many months before they actually isolated the bacterium that caused the disease. And it was probably, I believe it was the press who gave it the disease the name Legionnaire's disease, probably even before they even discovered which bacterium was causing it.
Awesome. Thank you, David. Okay, next question, David. Is Legionella I nearly did it again. Pneumophila.
Okay. So Legionella pneumophila is one of many species of Legionella bacteria. So Legionella is its own genus and family of bacteria. There are gram-negative bacteria that are oxygen dependent. We say they're obligate aerobes. And so Legionella pneumophila is the first species, and Legionella pneumophila serotype 1 is the first species and serotype that was actually diagnosed and is associated with the first outbreak. So Legionella pneumophila is just one of the many, we believe up to 89 different species and serotypes. New ones are being discovered and described every year. And this one is, however, the one that is attributed with the vast majority, over 90% of diagnosed cases of disease in the U.S. and probably worldwide. There's some areas of the world where other species of Legionella cause more disease, but this one is the preeminent one here in the U.S.
Thank you, David. And if anybody's wondering, I actually, in my Scottish vernacular, call it pneumophila. So I'm always laughed at by David and everybody else that I know. So David, next question. And this is an interesting one, what are the key differences between Legionnaire's disease and pneumonia?
Well, Legionnaire's disease is one type of pneumonia. So pneumonias are typically an infection of the lungs where there's fluid building up in the lungs, loss of function within the lungs. Any general type of pneumonia could be caused by bacteria, by viruses, or by fungi. Some types of pneumonias can be caused by metal fumes or certain types of toxins or poisons or pesticides. But this one specifically, this type is caused by Legionella bacteria, that can get into the lungs when you breathe it in small water droplets. And so, unfortunately, it looks like most other pneumonias. So, in order to diagnose if your pneumonia is caused by Legionella, a specific series of tests have to be performed. The most common is urine antigen test. So a urine antigen, or UAT, is done, and it specifically is looking for antibodies that are produced by Legionella pneumophila serotype 1. So that's the most common way it's diagnosed. There are, I'll say, less common ways today. Over 94% of cases of disease are diagnosed with urine antigen test. But we still recommend, and physicians should be doing culture tests so that the isolates can be compared to environmental contaminants that we find. So there's a few ways to test it. None of them are pleasant as far as getting the samples, and they take time to grow. But it's pneumonia. Legionella is a subset of pneumonias, and is one of the many ways you can contract pneumonia.
Thank you, David. You have kind of alluded to this next question, but I want you to go a little bit deeper because this gets asked a lot as well. What is the history behind the first outbreak of Legionnaire's disease? How did it start, and why, and what was the outcome?
Well, there was like I said, a convention of the American Legion in 1976. I believe it was in late July, and hundreds of attendees were at the convention at the Bellevue Stratford Hotel. There was even a parade outside for World War II veterans, and many of them, the hospitals literally started filling up with them. Physicians were diagnosing this undiagnosable disease of pneumonia, and there was a pretty high fatality rate. It was, I think, close to 30% fatality. So well over 150 people were contracted the disease, and that prompted the disease detectives, the epidemiologic intelligence service from the CDC to come in. Well, so that's what really prompted it. But what was interesting is when they looked back at the records, they found that there was a very similar type of pneumonia of unknown origin that had occurred at the same hotel 2 years earlier. And, no one really called out the cavalry and brought in the CDC or asked for any help outside of the state health office. And when they went back and looked at those cases, and at the time they would collect and retain sputum isolates, blood samples, urine samples from people who had this type of outbreak. They never diagnosed it, never solved it back in 1974. But when they went back and looked, they found that it was the exact same disease. It just had kind of gone into remission in the building and or the water systems. And so it wasn't really diagnosed until there was a follow-on outbreak 2 years later. Now, this is where, by chance, a name is important. So we contract, we get the name Legionella, Legionnaires disease from the people who were affected. And the convention, the guys and gals who were at the convention in 1976, and thus we have Legionnaires disease. But by chance, if the CDC had been there 2 years before and investigated it and determined that the organism was present and had to name it at that point, the name of the convention that was the first one at that hotel to have that outbreak. Any idea what it is? It's the Order of Oddfellows.
Yeah, we talked about that before. Yeah, imagine calling the disease the Order of Oddfellows. You would want to get that.
It's all in the name. We may be talking about Oddfellows disease here rather than Legionnaires disease.
There's been many times I felt like an odd fellow.
Don't we all?
Thank you for that, David. Now, this next question is a little bit strange because we've covered it, but the question is, are there any other different types of illnesses caused by Legionella, or what other illnesses are mistaken and not diagnosed as Legionella?
Yeah, that's a tough one. Well, not a tough one. It's a multi-part answer.
It
It's
is
a
a
multi-part
multi-part question, but we didn't say this was going to be easy, David.
All right. So all diseases caused by Legionella are deemed to be Legionellosis, and that's a very general term. Legionnaires disease is a very serious pneumonia. It doesn't affect most people who are exposed, but those who are exposed and can develop the disease are often hospitalized, made very ill, um, and about 10 to 25% of them die from the disease. So it's a very serious condition. The organism also can cause a condition called Pontiac fever, and that was diagnosed from the Pontiac plant in Michigan, where they had a large outbreak of this short-lived, non-infectious disease that had flu-like symptoms, self-resolved. We think that that's actually more like a humidifier fever, where the endotoxins that are produced by Legionella cause us to have this hypersensitivity pneumonitis. Self-resolves, nobody goes to the hospital, everybody gets well, but the attack rate is around 97%. So the people who are exposed, it's a bunch of people who get sick all of a sudden, but then recover. There's a handful of other conditions where Legionella can actually get into open wounds, chest cavities, surgeries, implantations, and can cause a what they call extrapulmonary Legionellosis, where it can causes systemic infection due to most recently there was in heart patients, cardiac transplant patients, and cardiac patients. They have a device called a heater cooler unit, and it was found that those were actually contaminated with Legionella. And when they literally had the people's chests wide open in the ORs, that the Legionella in the room would settle into the chest and begin an infection. Those are the main, and that's a very rare situation. But the main ones that we deal with are pneumonia, Legionella pneumonia, Pontiac fever, which is still a diagnosable disease, but rarely ever reported because it kind of looks like the flu. And then, of course, extrapulmonary Legionellosis.
And is there diseases that are misdiagnosed from Legionella?
Yeah, so we it's been recognized by the CDC and National Academies of Science that Legionnaire's disease is grossly underdiagnosed. In order to truly diagnose it, only one of two specific tests have to be ordered by the clinician. Like I said, it looks like just any other pneumonia at first. Often it's the patient's inability to recover using standard antibiotics or treatments that prompt physicians to order either a urine antigen test or a sputum, a culture sputum. So a lot of times, COVID can be mistaken for Legionnaire's disease. Any type of bacterial pneumonias can be mistaken. And unfortunately, what it looks like is most physicians don't do the diagnostics to determine the antibiotic susceptibility and the specific organism. Often, a patient presents, they'll throw them a Z-Pack and say, if you don't feel better in 10 days, come back. Often what happens, though, is they start the Z-Pack, and if they're really going down with Legionnaires, they're back or in the hospital or in the ER in a couple of days. And so then that often prompts the differential diagnosis. But, you can't just look at the signs and symptoms of a person and say, that's Legionnaire's disease, or that's, pneumonia caused by Pseudomonas or by non-tuberculous mycobacteria or by COVID or any other type of virus. So it's, any type of pneumonia potentially could be Legionnaire's disease. I don't know that it really matters for most physicians because 94% of all cases are diagnosed with urine antigen tests. So they simply if they do any type of test, they're going to do the urine antigen. And I've worked with some of my patient staff and as well as local folks here, and sometimes just getting a physician to run that test if there's a suspicion of exposure is very difficult. So it's not standard, and it is inconsistently applied throughout the country.
Thank you for that, David. The next question is, I know you probably answered this as well, but maybe a little bit more as people ask this question. Is Legionnaire's disease contagious?
Contagious. So when we look at contagious, that infers that it is transmissible from person to person. And so while some people say, well, there's just one case that was asserted and claimed in one article in Europe, I would say that we don't have, say, clear or even compelling evidence that it is contagious and can be spread from person to person. It is contractable. I mean, it is a disease of environmental origin, and that's why it's quite unique. It doesn't pass from person to person, but it passes from device or water system or cooling, from some exposure to either a fixed or sometimes a mobile water source that can cause people to contract the disease. So for, I'll say, ill-informed or unaware public health officials or clinicians trying to track down the sources, if they don't understand the universe and wide variety of sources that we do know can cause exposure to Legionella, can be quite challenging. But no, it's not really. We have no indications that it is transmissible from person to person.
Thank you, David. And this is another question that a lot of people don't understand, but it's asked a lot: is can healthy people get Legionnaire's disease?
Well, they're not healthy once they've got it, for sure.
That's what I was going to say. It's a bit of a misnomer, that one, but yeah, we get it. Yeah.
Yeah. Well, all right. So we talk about mostly people with pre-existing medical conditions and compromised immune systems are at most risk. However, in any large outbreak, we're going to see 45% of the people who are diagnosed with Legionnaire's disease to have no known complications or pre-existing conditions. So most, maybe 50-55%, are going to be more susceptible. Account for most of the cases, but I've seen most people, I'll say most adults are susceptible to some degree. There's some exposures and conditions in medicines. So people who have cancer, even undiagnosed cancer, can be in those groups. People who are former or current smokers, so they may not consider that to be a medical condition, but it does put them at greater risk. People who smoke or consume THC or cannabis are at greater risk. There are very specific mechanisms by which THC or marijuana can inhibit and degrade our body's defenses and even make otherwise unsusceptible, young, healthy males susceptible to this disease. It is a funny thing when they say the elderly need to watch out for this, and they say that means anyone over 50, and I kind of take offense to that. But
I mean. So yes, thank you, David. So for last and final question, and this is quite like every parent wants to know this: is my child susceptible to Legionnaire's disease?
That's a really interesting one. That's really interesting. So we experienced this during COVID when we saw that certainly the elderly and people with compromised immune systems were more susceptible, and children seemed to be able to catch it, but often had little to no symptoms and seemed to, for the most part, not everyone, but for the most part, sail right through any exposures or disease that they experienced. Legionnaire's disease seems to be the same. It is extremely rare to see a child, anybody under 17, diagnosed with Legionnaire's disease. Now there are, in the neonatal intensive care units, there is severe concern there with these children because their lungs simply are not fully developed, and they are at risk and often deemed to be significantly somebody you want to protect. But for the most part, children are not diagnosed and recognized to be at risk from Legionnaire's disease in community-wide or even healthcare settings. So it's a mixed blessing, but it also raises a point of research. We should probably understand why. And that
I find that fascinating, actually. And you and I have had this discussion many times, actually, with some of our discussions. I really do find that fascinating, why that transmission or why it doesn't affect a child and yet it will affect someone older. I mean, we've seen it in cases that have broken out. I can mention, in what we had in Asheville with the State Fair, where you had healthy people that were contracting it. And so this all, isn't, and we should be doing a lot more research. David, we've come to the end of them questions. I'm happy to say you passed.
Oh,
so,
so
there's no curveballs there, but really interesting, ladies and gentlemen. And this is just the first one. Join us for the next one. We were talking more about sources and transmission, and everything else is good. We've got another 8 questions that we'll be putting David under the spotlight for. And of course, if you've got any questions at all or anything that's interested you here, then please reach out to us at hc3fl.com. That's hc3fl.com, and we will do our best to help you. But make sure you join us next time when we'll be diving even deeper into sources and transmission of Legionella. God bless.
Thank you.